If I could count on my hand the number of times I've heard parents say, I can only bring in one child because I don't think I'll be able to afford to bring in all my kids because dentistry is so expensive. Or I think I'm going to start with my oldest kid because I think the little ones are too young or they're going to be too scared to come to the dentist. So they're delaying treatment. For example, I saw a little guy probably about 3 weeks ago, and his family was worried about bringing all the kids in because of the cost and just even worried about his anxiety levels as well. This is what keeps parents from seeking care for their children. What holds them back is they're worried about finances, they're worried about the child's response to the dentist or to the dental environment. And delaying care, we all know that just puts the child at more risk. But the parents are really doing what they feel is best for their child. So this is what was happening for our patient, this little boy. So he was going around with this broken tooth and mom could visibly see that he had a hole in his tooth, so a cavity as well. Just very hesitant to bring him to a dental office, worried that he was not going to be able to get treatment done or that treatment was going to be out of her price range. So she brings him in and we're very easily able to gain a relationship with him early on. He liked a lot of things that my own son likes, so it was really quick and easy to build a relationship with him. That's the benefit of having so many kids, is that I have kids ranging from 15 months old up until 11 years old. So I'm literally in all these different child modes of life. And so I know what 11-year-olds like, I know what the 2-year-olds like, etc. So I gain his trust and we start talking and I give mom the quote and she's like, wow, I thought it was gonna be more expensive than this. And then she's thinking, okay, well, we're not gonna be able to get this done in one visit. It's probably gonna be multiple visits to bring him in to get all these cavities fixed, etc. And I'm like, no, we can actually start right now. We've booked enough time for you and your child so that we can get started today. And we've already started our relationship with him, so let's get started. And what mom thought was going to be 10 appointments long or 8 appointments or 6 appointments, it was merely just 2 appointments. The child was very comfortable and left very happy. And it always makes me feel really good when I have clients leaving, families leaving, and kids leaving with a smile on their face, right? We call it smiling dental, but it's even better when people are actually leaving and they're smiling as well.